नमस्कार. आयच्या खाशेल्या कार्यावळीन तुमकां सगळ्यांक येवकार. आमी केन्नाय जेन्ना भोंवपाक वयता त्या वेळाचेर जर आमकां कुत्रो दिसलो सगळ्यात पयलीं आमकां मनान प्रश्न येता तो म्हणजे त्या कुत्र्याक रेबीज आसा काय कितें आनी तो कुत्रो आमकां अटॅक करूं शकता काय कितें. रेबीज म्हणजे कितें आनी रेबीज कित्याक इतलो घातक आसा, रेबीजाक कसो प्रिवेंट करूं शकता, हे सगळे आयज आमी जाणा जावन घेतले. आमच्या वांगडा मिशन रेबीजाची टीम हेचे काही मेंबर्स आयज आमच्या वांगडा आसा. डॉक्टर मुरुगन अपुपिल्ले हू इज द डिरेक्टर ऑफ एज्युकेशन ॲट मिशन रेबीज. मागीर आमच्या वांगडा म्हाज्या वांगडा लेफ्टाक जॉयन जाल्या मिस्टर अक्षय पळ. ही इज अ सिनियर एज्युकेशन ऑफिसर ॲट मिशन रेबीज. लास्ट म्हाज्या वांगडा जॉयन जाल्या नमिता नायर. शी इज द मॅनेजर सर्वेलन्स अँड कम्युनिकेशन्स ॲट मिशन रेबीज. आणि ह्या वाटेन रायटान म्हाज्या वांगडा लास्ट जॉयन जाल्या ती म्हणजे रोटेरियन प्रिती शेट. शी इज अ पास्ट प्रेसिडेंट ऑफ रोटरी क्लब ऑफ Miramar and she is currently the director of New Generation. Welcome to our studio. So, Doctor, first question I would like to ask you is that why we should eliminate rabies?
It's a very good question. Namaste. Actually, 20,000 death every single year is estimated death of human due to rabies in India. So India is the hotspot. About 15 million owner dogs and about 35 million stray dogs. Is it not fair? We have to eliminate rabies. So much, and in which more than 50% of the casualties, the death is below 15 years old children. So this is the situation. So in case if you don't have a vaccine, see for example when we had COVID, we were losing our lives.
Yes.
So many people were dying. But when we found the vaccine, then immediately we were able to win over. And we were able to save, we don't have COVID now.
Yes.
But in case of rabies, we have the vaccine already available.
Yes.
For more than 100 years, thanks to Louis Pasteur. But still we are losing life. Is it fair?
No.
So that is why we have to eliminate. More than that, the government of India is spending crores and crores of money on the prophylaxis and to control this rabies and the rabies elimination. So all these things are making us a little bit serious, and this is time now we have to rise up the occasion. And
Yes.
the WHO has now got a deadline. By 2030 we have to eliminate rabies from globally.
So 6 years for now.
Yeah,
we have 6 years time.
We have to be very quick. And then that is the reason everybody needs to be aware of this situation, and we have to rise up to the occasion.
So one more thing I would like to mention that की आमी गोवा ही रेबीज फ्री स्टेट, रेबीज कंट्रोल स्टेट आसा, रेबीज फ्री स्टेट ना. मोस्ट ऑफ द टाइम इट इज मिसइंटरप्रिटेड दॅट गोवा इज रेबीज फ्री स्टेट, पूण आमी हे नोट करपा जाय की इट इज रेबीज कंट्रोल्ड स्टेट. So one more thing I would like to ask you is that what is the role of government in this project?
Yes, absolutely. Thank you so much. Because but for the Goa government, this is nothing. The project could not have been taken up. Because when we came to Goa, the visionary person is Dr. Luke Gamble. He is the CEO of Mission Rabbies. When he came to Goa to demonstrate that this is a possible project, because as you know, this is a complex disease, human-animal disease, not even one animal. All the mammals, any mammal can have the virus. So such a complexity is there. 130 years we are not able to eliminate. At this scenario, Mission Rabbies came to Goa to demonstrate to the Goan that it's show the project that it is possible. First of all, people should understand whether it is possible or not. So many years we were not able to do it. So to make the Goans to see that it is possible, Mission Rabbies came and demonstrated. We did about 20,000 dog sterilization and vaccination during 2014, and that was impressing the government, and government took it up. And government of Goa was, I have to say, the initiative taken by the government of Goa, and they felt that this is a project to take up, and we joined with the government of Goa. And this is a government project now.
Yes.
So the entire thing is reviewed by the government, and we are going along with the government. Government is also partly funding this project. So this is a government project where the government is having the review committees. We have two committees. One is the state level by the minister, another one is district level by the collectors. And the project is being reviewed, and the government is always advising us what to do wherever we are going right or wrong. So these are all the advices, and the monetary thing also is given by the government. and that is something which we have to appreciate, because Mission Rabbies is operating in many states and many countries.
Yes.
So comparing to all other states and all other countries, Goa has set a model. Now the Goa government is writing to other states and other governments to take the Goa model now, so which is being done. So recently, last year, about 11 other countries came here from South Asian countries and took training in Goa model.
That's great.
And we are also taking this Goa model to other states, like we are operating in around 8-9 states now. Inside India. The Goa model is going state by state. So you can understand. So how proud we are and how proud the government is.
Yes. So you mentioned about the vaccines. So I would like to ask you if like during the COVID times we had taken the vaccine so that we cannot have the disease, to prevent it. So if a person takes the rabies vaccines prior to the bite, the person can still get the rabies.
No, actually, no. The vaccination means it is controlling the virus. If you take a vaccine, it is producing antibodies.
Yes.
It is able to win over because it is stopping the virus and killing the virus. This is the thing. But in our endemic scenario, for example, endemic means already we have so much of virus and so much of the disease all dogs are harboring in India. In this scenario, so taking that vaccine one time and just thinking that you won't be getting it is not possible. So this virus, the vaccine which you are taking, that is a pre-exposure prophylaxis virus, vaccination will help you to develop some immunity. But at the same time, when you are getting a bite, naturally you have to go to the hospital for further this thing. But that will be mild. You won't go for any death or anything. But this will help. The pre-exposure vaccination is really going to help it. That is it.
I'll come to you, sir. सर तुम्ही आता सिनियर एज्युकेशन ऑफिसर आसा, सो जशें सरान मेन्शन केलें की आमी डेथ पळयतात ती भुरग्यां मदीं चड पळयतात बिलो 15 इयर्स. सो तुमी ह्या बद्दल अवेरनस लोकां मदीं किंवा भुरग्यां मदीं कशें कितें करता?
फर्स्ट स्टार्ट करपाचें म्हटल्यार खुबशे स्कुलां जीं आसात 2014 सालाच्यान आमचें अवेरनस स्कुलांनी कॉलेजींनी कम्युनिटीनी आमी करत आसात. म्हटल्यार 1623 स्कुलां आसात, तेतूंतले 80% जी स्कुलां आसात ती आमी दर वार्षिक कवर करतात. म्हणटकच आतां सरान म्हटलां ती भुरगे चड अफेक्ट जातात, म्हणजे आमचो ऑडियन्स जो टार्गेट आसा तो भुरगे आनी चड गरीब समाजाचो लोक, मायग्रंट वर्कर म्हणा, पोस्टमॅन म्हणा, किंवा इलेक्ट्रिसिटी डिपार्टमेंटाचे लोक बिलां बीन दिवपाक वतात घराघरांनी. सो तांकांय डॉग बायट इश्यूज जाता. सो हे सगळे कम्युनिटी तशेंच भुरग्यांक आमी कवर करतात. लेसन्स दितात, कुत्र्या कडेन वागप कशें, चावल्यार करप कितें, त्याच बरोबर पिसावलेल्या कुत्र्याक कसो वळखप. सो हें केल्ले कारणान खुबसो बदलाव आयला. कित्याक लोकांक कळ्ळां आतां, तशेंच भुरग्यांक कळ्ळां कुत्र्या कडेन आमी वागप कशें तें. सो आतां तें जाल्ले कारणान हे डॉग बायट इश्यूजूय भुरग्यां भितर कमी जाता.
आणि एक गजाल आमी पळयतात की खुबश्या फावटी भुरगे तेंची कळ काडपाक वयता. एकदा जर कुत्रो बसला जाल्यार ती कळ काडपाक वयता आनी तेच्या लागून मागीर ते अटॅक करतात. किंवा आमकां एकदा कुत्रो सपोज आंगार येयलो जाल्यार आपूण भियातात आनी धांवतात. सो तो आनी एग्रेसीव जाता. सो ह्या बद्दल तुमी कितें अवेरनस करता?
हें तुमी विचारून खूब बरें केलें. तुमच्या प्लॅटफॉर्मा वयल्यान म्हाका लोकांकूय सांगूंक इच्छिता हांव की थोडे पॉयंट आसात ते तुमी फॉलो करपाक जाय डे टू डे लायफ. कुत्र्याचो बायट एवॉयड करपाक इट इज पॉसिबल ना अशें ना, पूण लोकांक तें समजना. आतां 7 पॉयंट आसा, थोडक्यात सांगता हांव तुमकां. पयलें म्हटल्यार कुत्र्यान केन्ना आपलें जेवण जेवता, न्हिदले कडेन आसता, ल्हान पिलांक दूद दिता, तेंच्या लागीं केन्नाय वचपाक जायना. तशेंच कुत्रो आतां आसा तेजेर फातर मारप, तेज्या दोळ्यान दोळे घालून पळोवप, तेंय कुत्र्याक एग्रेसीव करूंक शकता, इन्स्टिगेट करता आनी तो एग्रेसीव जावन चावूंक शकता. सगळेच कुत्रे करतले अशें हांव म्हणना, पूण थोडे कुत्रे एग्रेसीव जावंक शकता आमी हें करून दोळ्यान दोळे घालून पळयलें किंवा फातर मारलो. सो ते आनी याद दवरतात आनी एक दीस आपलो घात घेतात. सो हें करपाक जायना. आनी तशेंच केन्नाय कुत्रो मनशाक चावपाक येता. आमचो मनशालो स्वभाव जावन आसा की आमी किळाच्यो मारतात, धांवपाचो प्रयत्न करतात. हें सामकें चुकीचें. केन्नाय कुत्रो आयलो चावपाक कोणाकूय, भुरग्यांक, जाणट्याक, व्हड मनशाक, सदांच याद दवरपाचें एकूच जाग्यार थंड उबें रावपाक जाय आनी कुत्र्या कडेन पळोवप ना आनी दुर्लक्ष करपाचें. हें केल्ले कारणान हांव अशें म्हणना की सगळेच फावटी तुमी सेफ जातले, पूण 90% ऑफ द टायम्स कुत्र्या कडेन तुमी सेफ उरतले. धांवत किळाच्यो मारत जाल्यार तो कुत्रो 100% चावतलो. सो सगळ्यात बेस्ट उपाय एक जाग्यार रावपाचें आनी कुत्र्या कडेन दुर्लक्ष करपाचें हें तुमी करूंकूच जाय. पूण जायते फावटी ल्हान भुरगीं जीं असतात, ल्हान भुरगीं हांव जेन्ना सांगता चवथीचे सकल जीं भुरगीं असतात ती खूबच ल्हान असतात.
बरोबर.
तेजेर हांव म्हणूंक सोदतां सदांच ती भुरगीं आवय बापयच्या नदरे सकल आसूंक जाय. तांकां ज्या जाग्यार कुत्री चड आसात थंय भुरग्यांक अशें सोडूंक जायना आवय बापायनी. सो ते ऑब्जर्वेशनाचो. आतां जी 5वेची भुरगीं आसात हांवें जें सांगलां तें करूंक शकतलीं, पूण ल्हान भुरगीं आहा ती करूंक शकना.
बरोबर, ती खूब कमी वय आसता.
सो हें लोकांनी पाळूंक जाय. आनी त्याच बरोबर प्रायमरी फर्स्ट एड हो सामको गरजेचो. आतां वॅक्सिनेशनाचे सरा कडेन तुमी उलयलेत, पूण तितलोच इम्पॉर्टन्स प्रायमरी फर्स्ट एडाक आसा. जेन्ना रेबीज आशिल्लो कुत्रो मनशाक चावता तो वायरस आंगान वता, सो तो वायरल लोड जो आसा खूब आसता, लाळेन आसता तेजो वायरस. तर तो घावो तुमी सारको 15 मिनटां कसल्याय साबणान बरें धुतात जाल्यार खुबसो पर्संटेज जो वायरसाचो आसा तो धुवन वता, कमी जाता. सो प्रायमरी फर्स्ट एड सामकें गरजेचें. 15 मिनटां साबण घेवन बरें धुवपाक जाय. तेजे उपरांत आयोडिनाचें लिक्वीड फार्मसीन मेळटा, तें सगळ्यान बेस्ट लिक्वीड, सो तें अप्लाय करपाक जाय. मागीर रोखडे डॉक्टरा कडेन वचून ती इंजेक्शनां तुमी घेवंक जाय. सो हें सामकें गरजेचें. सो तशेंच आमी भुरग्यांक आनी तशेंच लोकांक सांगता, कम्युनिटीक सांगता, खंयी समजा तुमकां पिसावलेलो कुत्रो किंवा रेबीज जाल्लो कुत्रो खंय दिश्टी पडलो जाल्यार आमकां रिपोर्ट करपाचो. आमचो हो कार्ड जावन आसा, ह्या कार्डार आमचो नंबर आसा, तो लोक आमकां अप्रोच करतात आनी आमी मागीर त्या कुत्र्याक आमची सर्वेलन्साची टीम आसा ते वचून त्या कुत्र्यांक हाडटात. मागीर हेजेर इन डिटेल मॅडम उलयतलीच, पूण आमी आतां कुत्र्यांक कशें वळखप तेंवूय सांगतात भुरग्यांक. आतां रेबीज आशिल्लो कुत्रो आसा समजा, ताका कसो वळखप. तोंडांतल्यान खूब लाळ व्हांवता, तोंडा कडेन फेस कसो आयिल्लो आसता, त्या कुत्र्याक रेबीज जावं येता. बिना कारण मनशाक चावप, लाकडाक चावप, वणटेक चावप, वाऱ्यान तसो आपलो चावताशें करून दाखोवप, त्या कुत्र्याकूय रेबीज आसता. आनीक प्रकार जो आसता पॅरलायज, म्हळ्यार कुत्रो पॅरलायज जाल्लो आसता, चलता चलता परत पडप, ओगी एक कॉर्नराक बसून रावप, कोण लागीं गेल्यार घास काडप. सो हे सगळे प्रकार जे आसात ते रेबीज आशिल्ल्या कुत्र्याचे. सो असलो कुत्रो कोणाकूय दिसत जाल्यार लोकांक अपील करूंक शकता, आमकां मातशें कळोवपाचें, आमी येवन मागीर त्या कुत्र्यांक घेवन वतले.
सो तुमी एक बरी मेसेज दिली की अशे कुत्रे जेन्ना आमी पळयतात पिसावलेले किंवा तांकां दिसता की घास मारप, ते वेगवेगळे तुमी सिमटम्स सांगले, त्या हितूंतल्यान लोकांनी अवश्य हे पळोवचें आनी तुमकां इन्फॉर्म करचें अशें मागता. मॅम, आय एम कमिंग टू यू. There have been the few cases in past. We have been seeing for the last like 2 years there have been cases of dog cases, not human cases. Human cases was only last year, if not mistaken, the death.
Yes.
So previously we did not have any cases.
Right.
So what is the current number, or how about dog cases in rabies or in Goa?
Right. So, as rightfully mentioned, we have a very active surveillance team in Goa, and our hotline works 24/7. We have a staff at disposal 24/7. We follow the right steps to remove a suspected rabid dog from a location as soon as possible. This has been ongoing, and for the year of 2024, we've actively got 5 suspected rabid dogs which tested positive in Goa only. We've also been doing active surveillance in the borders of Karnataka and Maharashtra. We have been getting dogs in these regions as well. So 5 cases, one from Bicholim, one from Thivim, 2 from Diwar and 1 from Kolwale. And one from Valpoi as well. These are the dogs that we are looking at where the cases have come from. Immediately after we have tested, we also have sent a team out to create more awareness. Like the education team definitely goes in. The surveillance team also goes ahead, gives the card door to door, speaks to people, tells them to identify, same thing, identify a dog if you see anything. Because the chances of one dog being in that locality and then immediately finding another one is very likely possible. It's very high too. So it might just be a hindsight that a dog is just in the neighborhood. So the sooner you know, the sooner we identify, the sooner you call us, we are able to remove the dog and keep the community and the other dogs as well in that area safe.
So you are going to in areas and promoting the Mission Rabbies, or you are trying to prevent rabies. So how has been the support from the public?
Fantastic. Goans, as always, have been welcoming.
Hmm.
They have also, most of the cases that are reported also is by locals itself. We have a lot of support from animal husbandry department. There's a
Hmm.
lot of veterinary doctors who call us first, and they call us on our personal numbers to tell us to reach sooner. The support has always been good. We still, it is never enough. We still
Yeah.
need to continue the awareness that we create. We need to continue the message that goes out. We need to continue the work. That is why relentlessly we've been working for the past 10 years, and we continue to do so. So there is no problem in lack of support, but we will always be urging the public to call us anytime, every time you feel there is a doubt. We will be there. If you think it's a rabid dog, Mission Rabbies team will arrive. We should be your first call, and we should be there, right there on your speed dial if you see a rabid dog. That we will continue to urge for the public forever to always call us if you see a rabid dog. Do not handle them by yourself. We have experts on our team. Our catchers are, everybody's vaccinated. Our team is also very fully vaccinated. We have vets on board. So do not try to handle these things by yourself. Just call us. We will handle the entire scenario.
Okay. So one more thing, ma'am, I would like to ask you that is it only the dogs, or you are vaccinating also the cats and other animals which are prone to these diseases?
So our project is focused on dogs because as we've seen over a period of time, one of the biggest carriers of rabies has always been dogs. If you see cats, they don't run in packs. If you see cattle, they don't bite. So usually
Yeah.
that's the end of the disease. Like that's the last person who gets it, or the
Okay.
last species that gets the disease. But dogs, on the other hand, run in packs. They are a pack of 6 or 7, or they come to home and they'll bite 2 kids, or they'll bite another 5, 6 dogs, and the cats and the cattle. Um, since this is the pattern that we've noticed, we've focused on finding the rabies, or stopping the rabies rather, at the source, which is the canine species, which is the dogs. So we are focusing on vaccinating dogs. But sure, if you have a cat and if you're able to handle the cat, we will vaccinate. We've never said no for vaccination, because end of the day our goal is to protect all the species that is there.
Yes.
But the best way to reach is to find it from the source and stop it. Hence we focus on canine vaccinations.
Okay. Priti ma'am, I would like to ask you, is that how you joined this project and why you selected to join this project?
As a main motto, as a in Rotary, आमचे
Yeah.
main motto असता community service,
Okay.
which is a responsibility of every individual also.
Yes.
पण कितें जाता, like Rotary sees also, we have been part of end polio movement. We support medical sectors also. So तशें लागून Mission Rabies was the need of the hour, which was from now it is controlled. From a free we reached to a control, and like Dr. Murugan, he is
Yeah.
also part of our Rotary.
Yes.
We are a team in our Rotary Club of Miramar. So त्यांचे जेन्ना start जालें काम 10 years back, no. So I have a family school in Pororim.
Yeah.
So that is how our development grew. He used our school to explain why we should eradicate and eliminate rabies through skits, dramas, demonstration. Like everything what Sir Akshay explained now in
Yeah.
short, but it is elaborated through the skit and street play. It is written and directed by Dr. Murugan only.
Okay.
So since 10 years our school is associated with him. So knowing that it is a very good mission, and it had already come into our Rotary Club also.
Yes.
So on a the Mission Rabies is doing it at a very large scale. Their efforts are taking shape also.
Yes.
We in our own small way are supporting it from school level and the club level. आमचे काम कशें जाता की अवेरनेस कितले वाडयता तितले we will be able to help society. So with respect to building awareness, we conduct sessions, awareness sessions, talks, street plays, student rallies. In all these ways we thought we can support them in eliminating rabies or eradicating, or we also conduct drawing competitions all over Goa. Most of the schools are spread out, take part, and like he said, under 15. So the awareness starts from first standard onwards.
Okay. That's great.
त्यांचे कॅटेगरीचे एज ग्रुपाक कॉम्पिटिशन दवरता, आणि सेकंडरी ऑल्सो, विच इज गिवन अ स्पेसिफिक टॉपिक. सो the point is very well taken home, because children carry the message home
Yes.
So from schools it reaches a bigger medium also, no, compared to having it in a certain smaller point of contact. Through
Yeah.
school it is reaching to that many houses.
Yes.
So the children are our main focus of spreading the message.
जसे तुम्ही म्हटले मॅम, हे बरोबर आहे की दोनाय वाटेन. जसे तुम्ही म्हटले की तुमचो ग्रुप सपोर्ट करता, तुमचो ग्रुप फुडें येवन तांकां सपोर्ट करता, इट्स अ ग्रेट थिंग. तुम्ही म्हटले की यू सेड दॅट पीपल आर व्हेरी मच कॉपरेटिव्ह इन सपोर्टिंग दीस मिशन. सो अशा प्रकारचे जर आमी पळयले की लोकां कडल्यान आनी ग्रुपा कडल्यान जेन्ना सपोर्ट येता त्या वेळाचेर खंयचोय जो डिजीज आसता तो आमच्या खातीर आमी बेगींतल्या बेगीन एलिमिनेट करूं शकता. Dr. Murugan, I would like to ask you about the, yesterday I was reading about the rabies. So there I found that human to human also there is possibility. Is there any possibility?
I mean, scientifically if you say it is possible, but in general it doesn't happen, because whenever a human is getting this disease, and he is not allowed to run around or spread it, or like what the dog is doing it. So in practice it is not possible, but there is a possibility, because the saliva of the human can definitely cause rabies.
Okay.
And see, for example, in the human cases, you know, if you go to the hospital those days, even now in many places, they will have exclusive cell for human. I have seen it when we were doing the project in Madurai. About 5-6 rooms are there exclusively for human rabies cases. Then they lock them up, so the saliva is not spreading. In the case of the humans, whenever the human is getting it, the saliva is not spreading. So from human to human, it is not getting recorded. So, but possibility is always there. Possibility is always there. So in general, not like dogs. The dogs is spreading, but in human it is not spreading. That is another one. Yes.
ओके. अक्षय सर, तुमकां हांव एक क्वेश्चन विचारपाक सोदता की सद्या डॉगाची आमी संख्या पळयता की दिसान दीस वाडत चल्ल्या, एरियांनी वाडटा, तर ह्या विशयी तुमी कितें अवेरनेस किंवा कितें करता?
आता पहिली गोष्ट म्हणटा ती सोसायटीन कुत्रे खूब जाल्यात, सगळ्यांकूच खबर आसा, सगळ्यांक तांचो त्रासूय जाता. पण कितेंय गोश्ट आमी आयुश्यान सुरू करतात, म्हाका तरी दिसता आपल्या स्वताच्या घरान पयलीं सुरू करचो आनी मागीर त्या सोसायटी फॉलो करता. तर लोकांक होच अपील आसा, जेन्ना तुमी घरान कुत्रे पोसतात तेंचे तुमी स्टरलायज करून ऑपरेशन करून घेवचें, की ती आनी पिलां काडची न्ही म्हणून. आतां तुमी पळयलां आसतलें, लोक घरान ऑपरेशन करना आपल्या पोशिल्ल्या कुत्र्यांक, जेन्ना ती पेटे काडटा तेच पेट्यांक ते मागीर रस्त्याचेर फीश मार्केट म्हणा, बाजारान म्हणा, गार्बेज जे उडयल्लें आसता थंय व्हरून सोडटात. आनी ह्या तरेनूय कुत्रे वाडटा. म्हाका खबर आसा रस्त्या वयल्या कुत्र्यांचोय एक समस्या आसा, तीय पेटे काडटात, पण सुरवात आमी आमच्या घरा कडल्यान करूंक जाय. सो अपील आसा लोकांक की सगळ्यांनी आपल्या घरान जेन्ना कुत्री पोसतात जबाबदारी घेवची, आपल्या जनावरांची जबाबदारी घेवची, ताका वॅक्सिनां, तेजें ऑपरेशन केलां की ना हें सगळें तुमी काळजी घेयत, मुखार वचून तुमची भुरगीं शिकतलीं, तुमी करता तें पळोवन शिकतलीं. तें हांव लोकांक सांगूंक सोदतां.
ओके. सो तुम्ही सद्या लोकांक एज्युकेट करता, भुरग्यांक एज्युकेट करता. सो आनी एक प्रश्न जो म्हाका सहज सुचला आतां उलयता की तो म्हणजे आमी पळयता की वाठारांनी आतां संख्या वाडल्या आनी तेज्या कारणान जेन्ना एक मनीस जेन्ना टू व्हिलर घेवन वयता तेन्ना तेज्या फाटल्यान कुत्रे धांवतात आनी तो मागीर आबूज जावन खंय तरी तेचोय एक्सिडंट जाता किंवा तोय इंजर्ड जाता. सो तुमी त्या लोकांक कितें सांगूंक सोदता की त्या वेळाचेर त्या मनशान कितें करपाचें?
बरो प्रश्न विचारला तुमी, कित्याक हांव ज्या स्कुलांनी वता चडसो ह्या टिचरींचो प्रश्न आसता म्हाका, कित्याक ती मोटरसायकली चलयतात आनी हांवें म्हज्या अक्षरशा म्हज्याच दोळ्यान पळयलां खुबशे लोक पडल्यात हो प्रसंग घडून. पूण लोकांक जेन्ना कुत्रो फाटी लागता पयली गोश्ट म्हणटा ती रेस करून कांयच अर्थ ना, फुडें वचून एक तर एक्सिडंट जातलो ना तुमी पडटलीं. सो जिवाचो धोको आसा. सो लोकांक सांगूंक सोदता, केन्नाय आयलो कुत्रो चावत तर गाडी थंयच थांबोवपाची आनी ओगी रावना फुडें कुत्रोय थांबता. जशें हांवें तुमकां सांगलां कुत्रो चावपाक येता तेन्ना ओगी एक जाग्यार उबें रावपाचें, तोच प्रिंसिपल गाडी थांबोवन फॉलो करपाचो. तो कुत्रो येतलो खरो, तुमी रावला ते पळोवन कुत्रोय रावता, परतता आनी वता. पण ज्या नेटार तुमी वतात केन्ना केन्ना कुत्रो घासय काडटा ना गाडेपणा येता आनी तुमी पडटात. सो सगळ्यान बेस्ट उपाय गाडी लोकांनी थंयच थांबोवपाची आनी कुत्रे वच मेरेन रावपाचें.
मॅम, तुमकां एक क्वेश्चन हांव विचारपाक सोदता की रोटरी क्लब ऑफ मिरामार हेचे तुमी पास्ट प्रेसिडेंट आसा आनी तुमी सद्या ह्या मिशन रेबीजाक सपोर्ट करता. सो खंयचे एरियाज तुमी सद्या कवर करता? इज इट ओन्ली मिरामार ऑर पणजी?
ऑल अक्रॉस गोवा.
हां
लायक आमचे होर्डिंग्स लागला पब्लीक एरियाजान.
हय.
लायक वी हॅव यू मस्ट हॅव सीन इन बस स्टँड्स,
हं.
ॲट सर्टन जंक्शन्स. करंजले आसा, तालिगांव आसा,
हय
and even I think sir Kadamba also, no? Yes, that is the hoarding part of it. Besides that, student rally we have taken out in Old Goa, and students are shouting slogans when they are in the student rally. So बाकीचे आमचे dog floats बी असता,
हं.
which parade across Goa, and even the float goes across all the panchayats also.
हं.
So that much 1 month awareness is going on.
Okay.
And doctor goes from club to club giving his talks. Besides that, he has also till Sawantwadi he has given these talks.
बरोबर.
So तशें आमचे reach आमी try करता कितले जाता तशें.
हं.
And besides that, I think more it is into educating, creating awareness जाता तितले people gather करून to spread the word that how, like how they say, what are the causes, what are the symptoms, how you can safeguard yourself,
Yes.
किदें करप किदें ना ते सगळे डॉक्टरूच त्यांची टीम येऊन सगळे कवर करता.
बरोबर.
We initiative may be taken by us, but the team of Mission Rabbies comes and properly logically explains. आणि इतले तुम्ही पळयतली in schools, especially when we conduct these sessions,
हं.
भुरग्यांचे questions कितले असता. They see the skit, and then the kind of questions which they ask, very intelligent questions also, very practical questions also, means आम्हीच असे चिंतचेना पण kids will ask. So it is very helpful, and I think the message is getting across, which is what our effort we have to take from our side.
ओके.
So that is what we try to
Okay.
reach.
तुम्ही एक बरें सांगले की भुरगीं वेगवेगळे क्वेश्चन्स विचारतात, तांकां उत्सुकता आसता जाणून घेवपाची. सर, if a person is bitten by a dog, so sir has told that the first aid should be it has to be cleaned properly. So what is after that? What is the treatment?
Yeah, see, for a person, post bite it is called. So after a bite, a person is going to the hospital anyway. So for the post bite injections, before that, as he rightly said, the water wash is the best first aid. Just water, no cost. And just washing with water for 15 minutes with any available soap, you can remove the virus on the spot. Not allowing the virus go into the body, just like that.
Yes.
You become a doctor on the spot. So finish it, wash it, and get rid of the virus. Almost about 80% of the virus you can get rid of that on the spot. Then go to the hospital. Then don't put any bandage on it. And if you have any antiseptics, apply antiseptics to avoid any bacterial infection. Then go to the hospital. The doctor is there to give the course of injections.
Okay.
But those days you can understand, those days it was about 14 injections all over the abdomen.
Yes.
But now scientific world, beautiful, and we are blessed, then we have only about 4 to 5 injections. So the course of injections the doctor is going to give, and he will tell you when to come, like 0 day or 3rd day, 7th day, 14th day or 20th day. So he will give a course of injections, and based on that you just go for 4 times. Get rid of that, no problem.
So only 4 injections, but any allergy or anything the person can get with that? Any mild allergy? Mild allergy.
Normally we don't come across all these things, but some cases maybe the doctor may be able to advise. In some cases, in case if previously if he has an allergic things like that, he will be able to handle that. But in general, the vaccine is very potent and very safe, because we are seeing this for so many years.
So what message you would like to give our audience on this Mission Rabbies?
This is something, because as I earlier told you, there is a deadline in front of us, 2030 by World Health Organization, to eliminate this rabies disease. Before that, please understand, the animal love towards world is increasing day by day.
Yes.
Number of people who are getting the pet dogs is increasing.
Yes.
Every single house they want to have a pet. Even in India, for example, it is about 15 million pet dogs are now, which is estimated to increase to 30 million shortly. You understand? Such a huge number. People love animals because dogs are unconditional love they give. The dogs give unconditional love. 100% loyalty.
Yes, sir.
Understand? See, not only that, they are protecting people, because these days, the single parents are increasing.
Yes.
So the only company is the dog. You can understand.
Yes.
So all over you go, and even for people who are having BP or people who are having stress, and there are a lot of scientific studies, and they say if you have a pet at home, his stress level is coming down. If you have a pet at home, his BP is coming down. Even a dog, it is motivating you to go for an exercise, because you have to take the dog for exercise. You get exercise, so your health improve.
Yes.
So there are lot of millions of goodness towards dogs. But at the same time, due to this,
Yeah.
there are a lot of people going for dog petting, and they are going towards
Barobar.
pet animal, this thing. Unfortunately, people who cannot spare time, or people who do not have money or do not have space or anything for the animals, they also get dogs. But that is not good for the animal welfare point of it. This is not good for the animal.
Yes.
So at the same time, once they have the animals, they don't have money or they don't have time to go and get the dogs sterilized to control the population. They abandon it. They bring it to the market and leave the dogs on the road,
Barobar.
increasing the number of dogs. Community issue. You understand? So this is the other part of the dog pet ownership during these days. So now the need of the hour is responsible pet ownership.
Responsibility.
Because these days, you see a lot of dog bite cases, children dying,
Yeah.
and people, dogs biting, and issues going on between, conflicts going on, human-animal conflicts. All these things are going on. Why? Because the responsibility is not there with the pet owners.
Yes.
The responsible pet owner is the need of the hour.
Yes, sir.
So they have to take care of the animal. If you want to have a pet, make sure you have time for it. Make sure you have space for it. Make sure you have give the good health for the animals. Make sure you sterilize and avoid the abandoning on the road. Don't increase the population.
Yes.
Take care of them by vaccinating. So this is something, the need of the hour, and I want to appeal to the public. Secondly, you see, all the Goans should be proud now, because this is the only state, the first state in India, which has been notified as the rabies controlled area. And all over the country, all other states are following Goa model.
Yes.
So we became a model for the country. We have become a model for the whole world. When we were doing it during 2018, this impressed the whole world. From America, the CDC, Center for Disease Control, something like WHO,
Yes.
they came here out of interest and studied this project. And that time, government of Goa was also in a confusion. How it is going, because this is a new project. They were also confused, and Mission Rabbies was also confused. How this is going, whether we are successfully going or not.
Not.
So that time they came here and studied, and they conducted a program called the SHARE workshops, stepwise approach to rabies elimination workshop.
Yes.
And they declared that the project is going very good. It is an integrated project.
Yeah.
So it is not a new thing. For example, mass dog vaccination is not new. You understand? This is going on for so many decades.
Yes, sir.
But our project, it is an integrated scientific project where the number of dogs which are vaccinated are app oriented. We have an app to record where the dog is vaccinated, foolproof system, what dog it is, which animal it is, pet dog or owner dog or stray dog, all these things are
Vaccinated
recorded.
or non-vaccinated.
How many percentage we are vaccinated recorded, what area we have vaccinated, then slowly spreading, increasing this to 70%. So this is a scientific way of doing this project. So this is the method. Not just vaccinating or not just going and vaccinating 200 dogs in a place and coming back. That is also mass dog vaccination. So that didn't help. It is going on for about 2-3 decades. It was not helping to eliminate or control rabies. But now we have developed a system in Goa where it is a scientific way of doing the project. So this needs to be promoted to other states and other countries. And Goans should understand, I am appealing to the lovely Goans, that we should understand, we should be proud about this development here. We should know that our animals are now protected. You should not allow others, because now after the notification, as per law, anybody entering into Goa state, they should get their dogs vaccinated. So unvaccinated dogs is not allowed. So that is why you see, as my colleague Namita said, we have got the hoardings on the entry points at checkposts or railway stations like that, where we have the hotline number as well. So anybody who is entering do not have a rabies, vaccinated against rabies, they bring the dog, they have to call this number and get assistance and get this vaccinated. That is law. But how many are following?
Yes.
You understand? So people should follow that. Don't bring unvaccinated animal from other states. That is the reason in Diwar Island you saw
Yeah.
2 cases.
Two cases
How?
were there.
Like this. This is how it is. So people should cooperate.
Yes, sir.
They should not bring dogs into the our
The
land
unvaccinated.
without unvaccination.
No.
And also they should get their dogs vaccinated regularly, because we are not rabies free state. We are rabies controlled state, moving towards the target,
Yes.
moving towards the beautiful goal,
Yes.
godly goal. So let us all help. Until that time, we should get the dogs vaccinated. So we are having lot of projects going on. All these 6 talukas in the border states, as my colleague said, continuous vaccination is going on every single year, door to door, all is going on there.
Yes, sir.
That inside the 6 talukas inside, we are having because there is no virus inside the 6 talukas, no virus at all. After 2019 onwards, there is no virus. So that means people should not forget, and people should not think that we
there is
don't
no
have
virus,
virus
yeah.
and there is no rabies. But that is the reason we have a static point program, 1 month campaign, which is now going on already, where you have seen the Diwar Island. There was one big campaign started by the minister, and Margoa there is another big campaign started by the minister, and like that it is going on continuously until 26th of this month. So a lot of activities are going on to keep the people think that we should still protect our animals, we should be careful, we should get our dogs vaccinated, we should not allow other dogs to come inside without vaccination. So all these things is being promoted now. That is the idea.
Yes.
So for that people should cooperate. But now there is a good cooperation going on, because all the legislative party ministers, MLAs are involved. So thanks to the government. I am very happy this year. Lot of activities and lot of MLAs are participating in the willingly participating in their constituencies. And so I am seeing the papers, they are coming out with their this thing, support, and talking about it, and both in the assembly as well as outside. So this is now, a time has come now.
Yes.
So we are moving towards, so I am happy that we are moving towards the goal. So this should continue for a few more years. This should continue.
Yes.
So if they continue and support us, do not abandon the dogs, please. If you abandon the dogs, the dog number is increasing all the time. For example, recently, one of the finding for these 2 cases in rabies, when we were investigating, one of the finding is too many number of dogs in that island. So people seems to be dumping the dogs from the mainland and taking it and dumping into the island and coming back like that. So we were talking to these ferrywalas, and then educating them not to allow the dogs into the island, and all those things we were taking up. So that is how it is. People dump animals. This is not good for the animal welfare point of it as well.
Not also human welfare.
Yeah, animal welfare also it is not good.
Not good.
So people, if you are keeping the animal with you as a pet, please be responsible.
Yes.
Don't dump the animals.
Yes.
At the same time, be a responsible pet owner to get them vaccinated, get them sterilized, give them the good health.
Yes.
So that will really help. So if you are a good person, good pet owner, you are going to grow good, be at home. The children are going to be very good. They are going to be a beautiful human in the future, I tell you. There is a research finding which says anybody who is having a pet at home, the children becomes a good human in the future. So you understand the love, the love is more and more towards the animals is slowly carried by the children. The children become lovable children, and they become the best human being in the future. So we can utilize that opportunity and be a good pet owner, at the same time responsible pet owner. Thank you very much.
So thanks a lot for joining us today on this session, and I would like to thank your team and say all the best for the team to achieve the goal of rabies free state by 2030. That's a great thing you are doing, and continue to inspire and continue to try to achieve that goal. Ma'am, you are also the part of the team, so it was a pleasure having you here.
Thank you for having
and
us
the
here.
full team, I thank you all for joining us today. सरांनी जशें म्हटलें रायटली की रिस्पॉन्सिबल पेट ओनर, जनावर पाळप हे चुकीचें न्हय, तर ते रिस्पॉन्सिबली तेंची काळजी घेवप ही आमचें कर्तव्य आसा. तांकां वॅक्सिनेट करप, तांकां स्टरलायज करप, प्रत्येक गजालीची तेंची काळजी घेवची पडटा. आमी तांकां अबांडन करप ना किंवा तांकां रस्त्यार सोडप ना.